Well, the Centers for Disease Control and Prevention recommending COVID booster shots for 16 and 17-year-olds. The FDA has authorized Pfizer's third dose for that same age group. Joining us right now, Dr. Frank Esper from the Cleveland Clinic Pediatric Infectious Disease Department. Good morning. Thank you for being with us. Why did the CDC approve booster shots for teenagers 16 to 17 years old?
You know, there's been a lot of increased amounts of coronavirus infections that we've been seeing over the last several months. Many of these is all from the Delta virus. And what we see is that the Delta virus really is able to overcome some of the vaccine immunity after about 6-7 months. And so what we're trying to do is, and we've already recommended boosters for everybody who is 18 years or older. And using that same data, we see that a lot of 16 and 17-year-olds who have basically adult immune systems are able to also benefit. And so they expanded their recommendations to include 16 and 17-year-olds.
So how soon can these teenagers get the booster shot after their second dose?
You know, it's still the same recommendation as for adults, that they want you to wait 6 months after your second shot. For the most part, your protection lasts about that amount of time. And then right around that 6-month mark, it starts to wane, and that's when we start to see a lot more infections around 6 months after your vaccine series. And so that's why they're talking about the boosters 6 months out.
Are there risks for these teenagers, for these younger patients, in terms of getting this third shot? Any concerns?
You know, we always watch all these vaccines, you know, since the beginning of the vaccine program for problems and side effects. Vaccines are a medicine. All medicines have side effects, except that these vaccines have shown to be very, very safe. However, there are side effects from these vaccines. The main one that everybody's been watching very closely has been some heart inflammation, which we call myocarditis or pericarditis. This happens in a very, very small number of young adults, mostly men, usually in their upper teens and early 20s. And it happens extremely rare. It's actually still more likely that you get heart inflammation from the infection than it is to get it from the vaccine. However, it's something that we've been watching, and it's not been seeing, you know, about maybe 1 out of 10,000 plus times we see someone who has this type of inflammation. The other type of side effects is just the standard old, hey, my arm is sore, I have a little bit of a fever, and that usually goes away within 24 hours.
Now, when it comes to vaccine hesitancy, I wanted to talk about this because you can be in a family where the parents are vaccinated with their booster, and then the kids have different ideas about whether they need another shot. They probably didn't enjoy the first one anyway, but according to the U.S. Centers for Disease Control, about 46% of 12 to 17-year-olds are even fully vaccinated. What is something that you would tell parents to talk to their kids about in terms of getting a booster too?
You know, it is actually not uncommon that we see this situation where the parents and the grandparents in a family are all vaccinated, and yet the younger generation, not so much. And a lot of that is because, for the most part, the younger generation has been able to tolerate this virus much better. They're less likely to get hospitalized. They're certainly less likely to die or go into the intensive care unit. And for that reason, they're wondering, well, why do I have to take this particular vaccine? However, you know, it's the best thing that you can do in order to really encourage your child to get vaccinated is to be vaccinated yourself. That's the first thing. But also to just sit down and talk with them that the vaccine is not just for their own protection, which it is. It is there that helps that child, your child, to be protected from getting sick, but also it protects everyone around them. It protects your family, it protects their moms, their dads, their aunts, their uncles, their grandparents, their friends' grandparents, their friends, you know, their coworkers and their
We could go on
classmates.
and on, Dr. Esper.
Yeah.
Thank you so much. Thanks for proving that point at the end there. We appreciate your time. Thanks for joining us.
All right, it's very good having you. Bye.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.